Hello, everyone. My name is Omar Ammari, and I am a fellow scribe in the New York team at the Optum Pediatrics office in Lake Success. But I also happen to be the founder and president at the Arab American Mental Health Association, which is a youth-led mental health advocacy organization that seeks to reduce the stigma around mental health in the Arab community and other underserved communities that harbor similar challenges. And to raise awareness of free and accessible resources that work towards bettering people's mental health and well-being. Our main initiative involves educating people on mental health and the treatment options that are available, but another initiative that we work towards is people on the importance of cultural competence, specifically in the healthcare field. I mean, as future healthcare professionals, I I very much wanted the opportunity to speak with you guys on the importance of cultural competence within healthcare and how knowledge of it can make you better providers for your patients. Um, Without further ado, I wanted to begin. So I just wanted to start off by asking, how much do you guys know about cultural competence? Like, are you guys, I'm not expecting anyone to be experts, but what would you say from 1 to 5, 5 being expert, 1 being you've never heard of cultural competence before? What would you say your knowledge is?
And why don't everybody go ahead and put that in the chat?
I'm not able to see the chat, so I don't know if anyone's putting anything in.
So I'll help you out, Omar. So
Yeah.
we've got a lot of people who are at that 3 where they're familiar with it. We actually have a 4. We have somebody who's never heard of it before. And I think that's lots of 3s.
Okay, that's pretty fair. I kind of expected that. Everyone kind of has an idea of what cultural competence is, but no one really understands how, like, no one's an expert and really understands how it can impact people. I mean, it affects people in everyday life, but in healthcare specifically, that's what we want to focus on. And let's just get into it. I wanted to start by defining cultural competence. So, cultural competence is defined as the ability to understand, appreciate, and interact with people from cultures or belief systems different from one's own. So, cultural competence is essential in delivering healthcare services that are respectful of and responsive to the health beliefs, practices, and needs of diverse patients. It involves a conscious effort to understand and bridge cultural differences to improve patient care. And a culturally competent healthcare system can help improve health outcomes and quality of care and can contribute to the elimination of racial and ethnic health disparities. So, why is cultural competence important specifically in healthcare? So, one reason is better communication and understanding. Effective communication is the cornerstone of quality healthcare. When providers understand and respect cultural differences, they can communicate more effectively, leading to accurate diagnoses and adherence to treatment plans. Another reason is creating inclusive environments where everyone feels valued, respected, and comfortable. And trust also. Trust is built when patients feel their cultural values are acknowledged. This trust encourages patients to seek care promptly and share important information that the provider may need. It's also important that we provide equitable care to diverse populations and respect their cultural beliefs. And in conclusion, more effective treatments and improved patient outcomes can be found in more culturally competent healthcare systems. And even research indicates that culturally competent care improves patient satisfaction and health outcomes. For instance, the National Institute of Health notes that cultural competence can lead to better patient-provider relationships and increased patient engagement in their own care. So it is important that we as future healthcare professionals take the time to educate ourselves on cultural competence. So that's what cultural competence is and why it's important in the healthcare field. But what can happen if a patient is encountering a professional that's not culturally competent, or a healthcare system that's not culturally competent? How can it affect the patients? So one way is language barriers. So a lot of misunderstandings or incorrect diagnoses or inappropriate treatments can be found in healthcare systems where there's a lack of like interpreters or culturally competent material that's like translated. So when healthcare providers lack cultural competence, the risk of communication increases significantly. For example, misunderstandings about cultural expressions of pain can result in inadequate pain management. Also, religion can play a huge role. Differences in social interactions and religious practices can play a role. There's also higher rates of illness and mortality. Lack of understanding can also lead to longer consultation times, repeated visits, and inefficient care delivery. I just wanted to ask another question. Have you ever had an experience in healthcare where a lack of cultural competence caused an issue? So it's just a yes or no question. I can personally answer and say that I have experienced it in my job as a scribe and also in my job as an aide in the hospital. I have seen a lack of cultural competence affect patients and their family members. So I just want to see what you guys had to say.
We can go ahead and put that in the chat as well. So we have had some yeses here. All yeses so far.
Yeah. Yeah, that's to be expected. I think everyone has at least one incident where they've experienced cultural competence or a lack of it affecting people. And that's why as future healthcare professionals, it's our job to educate ourselves. So let's take a look at some ways we can better our cultural competence, understanding our education so that we can more effectively provide and treat our patients. So what challenges?
We did have a couple no's.
Yes. So there are some no's. Yeah, no, I mean, a lot of us are just starting out in our healthcare careers. Some of us are future doctors, future physician assistants. Some are future nurses, nurse practitioners. So it's inevitable at some point you are going to experience it. I've been in the healthcare field for 2 years now, and I've seen it in multiple instances. And especially when you work in underserved areas where there's a larger population of minority communities, you're going to definitely see it at some point. That's why it's important to be aware of it now. So how can we better our cultural competence? How can we provide for these patients and be better professionals in healthcare? One way is increasing education and training. Integrating cultural competence training into healthcare education equips future professionals with necessary skills to serve diverse populations effectively. This includes understanding cultural health beliefs and practicing respectful communication. Also, hiring healthcare professionals from various cultural backgrounds. Recruiting a diverse workforce not only reflects the patient population, but also brings varied perspectives that enhance problem solving in patient care. Another way is providing language services, like I mentioned before, interpreters or translated material. Offering language services is absolutely crucial. I mean, the CDC emphasizes that cultural and linguistic competence enables effective work in cross-cultural situations and enables better and more efficient patient care. And finally, collaborating with different community leaders. So engaging with communities helps build trust and ensures that healthcare services are tailored to meet the unique needs of different cultural groups and individuals. So I wanted to ask another question. How comfortable do you feel interacting with patients from a culture different from your own? So would you say that you're very comfortable, which would be a 5, or would you say you're not so comfortable? And I don't mean it as you don't feel comfortable approaching them. You don't feel comfortable understanding them or their background. Like how disconnected do you feel from your patients sometimes?
We do have somewhat uncomfortable. We have a couple 4s and 5s. Another 3, couple 4s. Lots of 4s. 4s are coming in, 4s and
Okay.
5s.
That's good. That's good. It is important
Yeah.
to be comfortable when you're interacting with patients. Obviously, not every patient's going to come from a background that you're familiar with or a background similar to your own. So it's important that you educate yourself on the different backgrounds and engage with communities that are different from your own, whether it's through volunteering experiences or your own work. So always seek out opportunities where you can engage with people of different backgrounds so you can be more comfortable with them. And I just wanted to switch over the presentation. I kind of wanted to transition in specifically into the Arab American community. So a lot of what my organization does and it focuses on is the Arab American community. There's so many different cultures, so many different ethnicities, backgrounds, religions that could be covered. And I can't speak on them because I'm an Arab American, so I can only speak and provide my expertise on this one subject. But there's going to be a moment in your medical careers where you do encounter an Arab American. If you haven't already, I know there's a large population specifically within some areas of New York and especially within Michigan and Dearborn and Troy. There's a lot of Arab American there. So it's important that you understand a little bit more about us. And I wanted to provide some information for you guys. So I just want to start off with a question, just testing your knowledge of Arab American. Do you think that a majority of Arab Americans are Muslim or Christian? And I just wanted to see what you guys had to say about that.
I think everybody's thinking before they put their answer in the chat.
Are we thinking or Googling?
We've got Muslim. Somebody would like for you to repeat the question.
Yeah, I'll repeat it again. Do you think the majority of Arab Americans, Arabs in this country, are Muslim? Do they practice Islam or do they practice Christianity?
And Muslim seems to be the most popular answer so far.
Okay, I am going to answer that question on the next slide. So who are we? Who are Arab Americans? So Arab Americans make up about 3.7 million of the population, so approximately 1.2% of the population. And we come from 22 different Arab-speaking countries from the Middle East and North Africa. A majority of the Arab Americans are American-born, but there's a lot more Arabs and refugees coming from overseas, so the population is quickly growing. And approximately 25% of Arab Americans practice Islam, while 63 to 77% practice Christianity. So a majority actually practice Christianity, even though a majority of Arab across the world, like in the Middle East, are Muslim. The majority of Arab American are actually Christian, and I found that fact interesting because I am Christian, but a majority of the Arab American I know around me and that I've met are Muslim. So I just wanted to share that fact with you guys. And another thing that's really interesting is due to Arabs not being classified as a distinct ethnic group under the US Census, they have been underrepresented in mental health resources, services, and research. So, like when you're filling out a form and it asks you what your ethnicity is, and it says white, Hispanic, Black, Asian, we always have to classify ourselves as white. So that just groups us together with Europeans and all the other ethnicities that may be classified as white. And it's important to note that Arab Americans we're not, we don't have the same culture or background as many Europeans. And I feel like it's very ignorant to just group us all together, and it can obscure the unique health challenges that we face. It's important to highlight that this classification masks critical data needed for health research and delivery. And it's a really cool thing to point out that by 2030, the 2030 census is going to have MENA, which is Middle Eastern North African, specifically stated as its own ethnicity, its own diverse group, which is good. So that means that they can start having like research tailored specifically towards MENA, and there can be more studies done on our health outcomes. but that's not until 2030, unfortunately. So what challenges do we face specifically as Arab Americans? Arab Americans face several unique challenges when it comes to accessing healthcare. One of the most significant barriers is cultural stigma, particularly surrounding mental health. For many Arab families, seeking mental health services is viewed as a sign of weakness or a failure to meet societal expectations. As a result, individuals often suffer in silence or turn to family or religious leaders for help instead of professional care. It's also important to consider religion, whether it's Christianity or Islam. Religious considerations also play a significant role. For example, in Islam, there is often a preference for gender concordant providers, especially for like intimate procedures. And fasting during Ramadan may affect how patients approach treatments like medications or surgeries. A lot of time, antibiotics, doctors tell you to take it with food, and how they're going to take it if they're fasting. So, that's something to take into consideration. Also, acculturation stress, adapting to a new culture. A lot of Arab Americans come from overseas, and it could be very stressful as a first generation immigrant. The process of adapting to a new culture, especially the US, which is very different from the Middle East, while maintaining one's own cultural identity, can be overwhelming and contribute to both mental and physical symptoms, and eventually issues in the future. And additionally, language barriers can make this transition even harder. Mistrust of the US healthcare system is also a huge thing. It's rooted in a history of discrimination and misunderstanding, especially after the events of 9/11. And there was a huge rise in anti-Islam and anti-Arab phobia. Um, and Arab Americans may feel that their cultural values are like dismissed or misunderstood by providers, and that leads to a lot of skepticism and delayed care, which is why a lot of Arab distrust the U.S. healthcare system or refuse to seek out doctors when they're sick. And finally, I just wanted to say financial barriers, which those cannot be ignored. That's it doesn't just affect Arab Americans; it affects a lot of minorities. Many recent minorities, especially and immigrants and refugees that come from overseas, lack health insurance or face economic challenges that make healthcare unaffordable. This financial strain is exacerbated for undocumented individuals who can't access public insurance programs. So, as healthcare providers, future healthcare professionals, recognizing these challenges is the first step towards providing meaningful and effective care for this community. So how can we overcome these challenges? So one of the most effective ways to overcome challenges in the Arab American community is to increase access to language services like interpreters, translated material. This includes hiring interpreters and that bridge the communication gap specifically between the provider and the Arab patient. Another way is to build cultural competence. So cultural competence training is crucial for healthcare workers to understanding key aspects of Arab culture, such as significance of modesty or family involvement in decision making and religious sensitivities around treatments like fasting or end of life care, for example. Trust, fostering trust. So fostering trust is super important. Trust is a cornerstone of effective care, and building partnerships with community organizations can help healthcare providers engage with patients more meaningfully. And finally, improving access to insurance or just making the healthcare more accessible and affordable. Advocating for systematic changes such as expanding Medicaid for immigrant populations ensures equitable access to healthcare services. And I wanted to give two case studies, one where a lack of cultural competence affects the patient negatively, and one where cultural competence is used to effectively address the patient and it makes everyone happy and it's how things should be. So case study one, a non-English speaking Arab patient delayed seeking care because they misunderstood a diagnosis and treatment instructions. So for this situation, a lack of language support led to a delayed diagnosis, demonstrating how miscommunication can harm patient outcomes, and it necessitates interpreters and having translated material. In case study two, a healthcare clinic partnered with an Arab cultural organization to host a health fair. They provide culturally sensitive resources, interpreters, and Arab-speaking providers, increasing trust and participation in preventative care services. So in the second example, a clinic partnered with a cultural organization to host a health fair tailored to Arab American residents. And this initiative not only improved access to healthcare services, but also built trust with the community and encouraged the members to seek regular care. And these are real world scenarios. These cases demonstrate the tangible benefits of cultural competence in addressing barriers to care and improving outcomes for underserved populations. And I wanted to finalize the presentation by doing a call to action, speaking directly to you guys, how you guys as future healthcare professionals can help and address the lack of cultural competence that's out there and make your patients feel heard and less ignored and make your treatment more effective. So I want to start by telling you guys to learn continuously. Cultural competence is a journey, it's not a destination. So as future healthcare professionals, we have an opportunity to make a lasting impact by continuously educating ourselves about the communities that we serve. So get involved with communities that are different from your own. Go volunteer at a soup kitchen. Go visit another country to learn more about their culture. There's many different ways that you can become more culturally competent. And I encourage you guys to do that throughout your pre-med journey, throughout your medical career, etc. Even when you become practicing physicians, PAs, etc. Always go out there and open yourself to different communities, different backgrounds. Another way is to advocate for change. So advocating for change is critical. Speak up for policies that promote equitable access to care and encourage the organization that you work for and companies you're involved with to prioritize cultural competence training. Another way is to get involved with your communities. Volunteering, like I said, attending cultural events, and engaging with advocacy groups are great ways to deepen your understanding and build trust. And finally, practice cultural humility. Remember that no patient fits a single mold, and listen to their individual stories. Respect their values, their backgrounds, and remain adaptable in your care. Together, we can create a healthcare system that people can trust and that truly serves everyone.